Hi, I'm Kirsty Freeman, the convener of SimHealth 2014 and the Simulation Education Coordinator for WA Country Health Service. A bit passionate about as an educational methodology that it gives you the opportunity to sort of bridge the theory to practice gap. Reading something in a book and someone demonstrating something to you isn't quite the same as having the ability to practice hands-on yourself. In the health profession, it's probably not the best that you practice some of those skills for the first time on a real person from a patient safety perspective. So simulation gives you the opportunity to put those skills into practice in a safe environment, both from a patient perspective, but also from a learner perspective. There's no way I'm going to harm myself when I do that for the first time. So that's sort of what got me into simulation. Yeah. So I work in the rural and remote sector, so for us to be able to use simulation to train clinicians that don't have access to larger education facilities, simulation is very portable, so we can take it out there to the regions, to the clinicians at the coalface, so to speak, and they can utilise those skills in their own environment and individualise it to their own needs of both the clinicians and the patients. So it's quite portable and flexible in that way. Simulation can, from a healthcare perspective, be quite costly to implement. So it's actually been quite flexible in how you implement the tools and the resources that you have. Sharing resources is really important. So doing simulation from in Western Australia from a large perspective in terms of the size in which you need to deliver things, ensuring that you share resources such as high fidelity mannequins, but tapping into local communities so that we can get our patients involved in the delivery of education, getting them to come in and do some training with the clinicians, gives them confidence that their clinicians are updating their skills through the use of simulation, and it also keeps the costs down and it gets community engagement. Networking. There's so much simulation happening in all areas of health across Australia and internationally, and in Australia we have so many key innovative people that are doing so many projects within simulation. So it's about getting what you're doing out there, tapping into other people's resources, not reinventing the wheel. Tapping in and seeing how you can take how they may have used a particular simulation methodology and try and apply that to your own setting. Yeah, so we have some world leaders within Australia in the field of simulation across all different states. States such as South Australia have been developing some fabulous simulation venues, meeting the needs of disciplines such as dentistry, medicine, allied health, nursing. It's about having a space where all those disciplines can come together and learn from an undergraduate perspective, which makes them work together more effectively in the clinical environment. For me, the biggest message about SimHealth 2014 has been the need for us to fill that implementation gap. There's some great things that people are doing, but we're still not quite perfecting how we implement simulation, particularly in the rural remote perspective. So we've come a long way, but we've still got a long way to go. And I think the connections that we've made this year at this conference have enabled people to network not only within their own state, other states within Australia and those internationally, to look at how they can meet that implementation gap in their own environment.